Hey everyone, I'm Jodi Eyigor, Director of Nursing Home Quality and Policy at Leading Age National. Welcome to Mental Health and Support for Supporters. Before we get started, I want to issue a trigger warning for today. We are going to be talking about you. So I know that we have been supporting our residents, supporting families, and supporting staff throughout the pandemic. We know what's involved with COVID-19. We've been through it all. But sometimes when we actually turn introspective for a moment, it can become a little bit more challenging, and we might be triggered by things that we didn't think were going to be difficult for us. And so if you feel that today, if you feel triggered, I want you to please feel free to step away from the screen, take a breath, take a walk. If you have any questions, if you miss anything, you can always reach out to me by email. I would be happy to answer any questions or to engage further in discussion with you. But the reason that we wanted to do this presentation is because when COVID started, when we first kind of were struck by this pandemic, it was a lot of crisis management, right? We were running around trying to make sure that we've covered all of our bases, trying to make sure that people survive. And we were running on adrenaline for a long, long time. But when the crisis kind of simmers down, and when we have a moment to step back and to look at what's around us, that's maybe sometimes where things start to fall apart. And so we talked a lot about the mental health of residents when things got a little quieter over the summer. And then it peaked back up again. And then we talked more about the social isolation as we were heading into the fall and to the winter time. But really, there's not been a lot of attention paid to you all, the people who are supporting the residents and the people who are supporting families and the people who are supporting other staff and supporters. And so that's what today is about. It's taking a look at what you all have been through and ways that you can support yourselves and support one another. So I'm sure I do not need to spend a lot of time reviewing what exactly you've been through over the past year, but just a quick review of what some of these specific stressors have been, because maybe you weren't really thinking of these. Maybe you had forgotten about this, or maybe it just didn't seem like an issue until you view it from a different lens. So there's been illness, there's been death. You have maybe had to deal with your own illness or the death of a close loved one at home. There's also, though, been the stress of a fear of illness or the fear of death. Even if it never came to fruition, that fear was still there and it was still weighing upon you heavily. There was the fear of exposure. Maybe I'm not worried about myself being sick. I'm worried about taking it home to my husband. I'm worried about taking it home to my aging parents or to my children. We've all had to deal with a loss of lifestyle. We have seen our cities shut down. We have seen entire states shut down. We have maybe not been able to get together with friends and family the way that we used to. And yeah, we're doing virtual gatherings and all that, but it's not the same. We've missed holidays. We've missed birthdays. We've missed anniversaries. We've missed just the traditions that we hold so dear, like going out on the river during the summer, or being able to barbecue together, or being able to go caroling or sledding in the wintertime. We've missed those things. And we've had the residual hardships as well, like maybe our housing has come in jeopardy. Maybe we've not been able to pay the mortgage. We've not been able to pay the rent. We've needed assistance paying for our utilities. Maybe we've lost our healthcare, or maybe our loved ones have lost jobs and have lost healthcare. There's been the exposure to widespread illness and death. And this can be both on the personal level, but also at the larger statistical level. And so we have maybe had 60 cases in 1 week at the nursing home. Or maybe it's that we are stressed by hearing case counts every single night on the news, or seeing it right front and center on the newspaper every morning. Maybe it's troubling to see the images on the news of hospitals being overrun, or you drive by the local funeral home and there's refrigerator trucks outside. All of those things have an impact on us. There's also been the stigma. We knew that nursing homes and assisted living communities were not the favorite places even before the pandemic, right? We kind of had a bad reputation because of the way that our society struggles with aging and mortality. But with the way that COVID-19 has uniquely impacted older adults and those with severe underlying complications like those we serve in our communities, we have been uniquely impacted. And so there's been a lot of media attention and a lot of public discourse about the way that COVID has impacted nursing homes and assisted living and other congregate settings. And so maybe we've had to deal a little bit with that stigma where it wasn't safe to go out to the grocery store wearing your scrubs or wearing your badge that said where you work. Maybe you weren't comfortable sharing in a support group that you were attending that you work at a nursing home because of the stigma that's attached to that. There's also been just the sheer prolonged stress and uncertainty. And so maybe the deaths are just something you take in stride, and the illness, it's something I've been doing. I've been in this field for 30 years. And so I'm used to hardships like this. But when we enter into the 8th month, when we enter into the 12th month, we're in our 13th or 14th month of this. Those months and months and months of stress are what wear us down. And so we were fine 6 months ago, but today is the day that we're just not able to handle it. And there is that uncertainty of every day you wake up and you're saying to yourself, is today the day that I get sick? Is today the day that we have the outbreak in our nursing home, or a new outbreak when we've barely recovered from the other one? Or how long is this going to go on? What's it going to be like when it's ending? Is it going to end? And what does the future hold for us? Can we even think about a future? I know they say that with trauma survivors, a foreshortened sense of future is kind of one of the experiences that they have, or one of the hallmarks of a trauma survivor. And I think that probably that's impacted a lot of us. I didn't realize how much I was not even considering the future anymore, because everything is such a day-to-day business with us. And we don't know where this is going. We don't know how it's going to end. We don't know what to expect. And so it's not until we start having the opportunity to look ahead to the future that we realize just how much we haven't been doing that, and just how much uncertainty we've been living under. And then we've had the stress of milestones, like, hearing that we've hit our 500th death in our county, or, maybe it's the 25th case that you've had in your nursing home. And there's the anniversaries. Maybe the anniversary of the first outbreak at that nursing home in Washington was really hard for you, and the time leading up to that anniversary, or the anniversary of the first outbreak in your community, the anniversary of your own illness, or the anniversary of the death of a loved one. And then we have the way that we show this stress, the way that we're experiencing the stress. So emotionally, maybe experiencing anxiety, depression, irritability, numbness, a feeling of apathy, like I don't care, I can't care anymore. Feelings of guilt, feelings of shame, feelings of overwhelm or hopelessness. Cognitively, you might be experiencing impaired memory, impaired concentration, impaired judgment, a poverty of thought where you want to contribute, you want to be able to focus on this conversation, but it's just not there. You just can't focus. You can't come up with anything to contribute. You just kind of draw a blank. An inability to make decisions. You just kind of feel frozen. You can't see a bigger picture, or you're weighing two options back and forth, back and forth, back and forth, and you really don't know what would be the best choice, and you're so scared to make the wrong decision. Or a cognitive rigidity where you are focused on what needs to happen, and it can't be any other way. You can't entertain creative solutions. You don't want to hear suggestions from other people. This is the way it is. This is the way it has to be. And you just can't manage broadening at any way, in any way, or changing that mindset. Physically, you may be experiencing headaches, muscle aches, fatigue, sleep disturbance, where you're unable to fall asleep at night, or maybe you wake up in the middle of the night, or you wake up early in the morning and you can't go back to sleep. Appetite disturbance, where you are just eating everything in sight, or maybe food holds no interest for you any longer. You have no appetite. Changes in your sex drive. You have no sexual appetite anymore, or maybe behaviorally, it's just an increased sex drive. Other behavioral changes could be impulsivity, avoidance, like you can't go into work anymore. Maybe you have staff calling out because they just can't come into the building. It's that triggering for them. Or maybe it's a little more subtle, like every time a story about a nursing home comes on the news, you have to leave the room. Or you're gathering very safely, socially distanced with masks, with some friends over the weekend outdoors, and they start talking about their experiences of COVID, and you have to leave the conversation. You just can't even be involved. You can't hear it. You can't be a part of it. You got to go. There's impaired coping, like you just can't manage the things that you once did. You don't know what decisions to make. You can't process information. You're just kind of a puddle on the floor and you can't do anything. Or there's unhealthy coping strategies, like maybe increased substance use. Maybe it's online shopping or gambling or some type of risky behavior or risk-taking behavior. Like I know that CDC is still recommending that I wear a mask, but I just can't anymore. I'm so over it. I'm tired of masks and I just can't anymore. So I'm going to go outside without my mask, or I'm going to gather together at a party with people who are vaccinated and unvaccinated because I'm taking these risks. So those are some of the things that we've experienced. Those are some of the ways that we have experienced them and the ways that they have impacted us. And so now we are beginning the tasks of recovery. And so what we're going to talk about now is what those tasks of recovery are and how we can support ourselves and also the staff in our organizations as we work through the tasks of recovery. And so this is borrowed from American psychiatrist Judith Herman, and she calls them the phases of recovery, but I've called them the tasks because of talking about this in a very concrete and actionable way. So there's safety and stabilization, and this is quite literally finding safety and regaining a sense of stability in our lives. And if you're familiar with Abraham Maslow and the hierarchy of needs, this would kind of be that base level in the hierarchy of needs. You are making sure that your basic needs are met. Then you have remembrance and mourning. And this is maybe a little bit higher up in that hierarchy, right? Where you're able to take stock of what you've been through. You're able to reflect on it. And then there's the reconnection and integration, where you have achieved stability, You have been able to reflect on what you've been through. And now you're starting to reconnect with some of the connections that were broken or lost during the time. Like you didn't have time to speak with your friends anymore, or you didn't have access to them because of lockdown orders and illness and things like that. But you're also integrating what you've been through into the person that you are now, and you're moving forward into the person that you become and into the world that we are going to live in as we move out of this time. So for safety and stabilization, there's a lot that we can do here. So I divided it up into 2 slides. The first is the supports that we can provide. So talking to friends, always helpful. Talking to coworkers and talking to colleagues. And I separate these out here and distinguish between the two because it's helpful to talk with your coworkers because you have been through pretty much the same experience. You have seen the same events and worked through it. But it's also helpful to reach out to others who are in the field, who have a really good sense of where you're coming from, but may have experienced different events or may have experienced the same events in a different way. And so talking with them can help you gather a different perspective on what we've been through over the past year. There's always seeking professional support. And I am a huge proponent of this. Full disclosure, I do have a master's degree in clinical counseling. And so, there was a time where I thought that being a therapist was like my calling in life. But even that aside, I truly believe that all of us, no matter who we are, no matter what's going on in our lives, can benefit from some really good therapy. Maybe it's because you need help solving a problem. Maybe it's because you're in crisis. Or maybe it's because you're not in crisis, you don't have any problems to solve, but you just need somebody to help you process these things and to look deeper and to conduct that psychoanalysis. And so I really encourage everyone to take the time and invest in themselves to seek professional support at some point. And this professional support can take a lot of different forms. So there's local and national hotlines that you can call into. There's hotlines for mental health. There's hotlines for grief. There's hotlines for suicide. And on these hotlines, they can give you a safe space to be able to talk out what's going on. It's a really good listening ear. And then they can help to link you to the next step of services. So they're probably not really providing the therapy. They're maybe not even providing that counseling and problem solving, but they're able to hear what the problem is, hear what you're struggling with, and then link you up with someone who can help you work through those things. You can check out the employee assistance program or your insurance program to find out what services are available to you, what kinds of counseling services, who the counselors are and who is covered by your insurance or who's covered by your employee assistance program, how many sessions are covered, what the cost would be to you, and making this information readily available to the staff in your organization. Maybe you're posting it on a bulletin board or you are including information in pay stubs or a weekly email or something that goes out so that everybody is aware of that employee assistance program that's available to them. You can also check with local mental health and social service organizations. They likely have counselors and therapists on staff there, and if not, they can, again, help to link you with others who can provide those services. Check out local support groups. And support groups can take a lot of different forms. So there might be general support groups, like we have all been through this horrific past year of COVID-19, and we need a safe space to come together and to process this. But there also might be more specific support groups, like support groups for healthcare workers, support groups for first responders, support groups for mental health responders. And a mental health responder, of course, is going to have a little bit different view on things and maybe have a little bit different issues that they're processing than a healthcare worker or a frontline first responder, that sort of thing. To find some of these support groups, to find out more information about where they are and when they're available, check with your local hospitals. Hospitals almost always have support groups available. You can also check with your mental health and social service organizations, but don't forget about your hospice and your palliative care organization. We know that they provide grief services for residents who have been impacted by a loss, right? Especially if there was a resident who was on hospice services, they passed away. The hospice team can come in and support the residents and staff. They provide services to the families after the resident has passed away. They are really, really good at handling issues of loss and grief. And so check with them to see if they offer any support groups or if they can link you up with any grief support and support around loss. You also want to keep an eye out for peer-specific groups. So again, we've all been through this terrible thing together, and maybe we have our cohort of healthcare workers who have been through this terrible thing. But within that cohort, we have people who are parents of young children. And so they have struggled with some unique issues, or they have confronted some unique issues over the past year that maybe parents of older children or adult children or people who are not parents have not experienced. The same with caregivers of aging parents or caregivers of adult relatives with some other type of disability, right? There's a lot of different subsets that there may be a peer specific support group available for. You also want to make sure that you are addressing addictions. And so keep an eye out for different types of addiction support. I know that Alcoholics Anonymous, for example, has information on their website about virtual support groups. Some may be meeting in person. So take a look, see what's available, and make sure that that information is available for your staff. And don't forget about Al-Anon or Narcanon, those types of groups. Those are for people who are maybe not struggling with the addiction themselves, but they are impacted by the addiction of a loved one, a family member, a household mate, that sort of thing. And then, of course, you can always keep an eye out for any self-help articles, books, or podcasts, and just making sure that your staff are aware of those as well. It could be really, really helpful to, and in an easily accessible way, right? A lot of podcasts are free. And so you can plug it in while you're driving to work in the morning and you're kind of getting that free therapy, that free support. Some other resources that you'll probably want to look into, and I've kind of addressed this by issue. So domestic violence. We know that during the time of COVID, there were a lot of services that were shut down. And things like shelters maybe were not the safest space. And so there may have been staff in your organization who were in a domestic violence relationship that it just wasn't safe to leave at that time. They had to do the best they could to maintain safety where they were. But now there's a little bit more option to address these issues. Or maybe there wasn't domestic violence, but the stress of COVID has brought this about. The same with abuse, right? Child abuse or elder abuse. Maybe these things weren't present before, but the stress of the past year have really brought them to the forefront. And so you want to make sure that you have resources available to support staff to get the help that they need. So looking for crisis line numbers that you can post, looking for information on shelters. Again, addictions, maybe they weren't present before the pandemic, maybe they weren't an issue before the pandemic, but over the past year, it's increased, or over the past year, we've become aware of a problem that has always been there, but we just weren't aware of it before. And so making sure that you have available information on support groups, information on those family groups like Al-Anon or Alateen, making available information on crisis lines and crisis services or treatment programs. And one thing that I'll note is that some treatment programs, like your needle exchange programs or your opioid dependence programs, are considered essential services. And so even if your state is completely shut down, or even if your state is partially shut down and working through a phased reopening, those treatment services might still be available no matter what phase you're in. Your staff or you may be confronting issues related to housing or homelessness. And so taking a look for things like mortgage or rent relief, information on utility systems to keep the lights on, information on shelters in case homelessness does become an issue. They may be confronting food scarcity. And so you want to make sure you have information available on local food banks, meal delivery programs. Maybe throughout the pandemic, someone wasn't able to check in on their family members as often, or the family members weren't able to come over for meals. And so they now need a meal delivery program in order to make sure that their aging parents are still eating every day. Or maybe folks need assistance getting enrolled in SNAP benefits, the food stamps program. There's also an employment issue. Now, probably if you are watching this presentation, you are employed, but that doesn't mean that those at home are employed. It doesn't mean that everyone in your family is employed. It doesn't mean that everyone in your staff members' families are employed. Maybe they have faced unemployment over the past year. And so having information available on unemployment benefits, maybe having information available on family medical leave and the emergency leave, having information available for disability leave or disability status. We've also heard of organizations that share leave among staff. And so a staff member has used up all of their allowable leave, but they still have a sick parent at home, or maybe their children are home from school and they don't have any childcare. And so we've heard of staff members donating leave to each other. We've also heard of organizations trying to address issues with transportation by maybe purchasing public transportation cards like bus cards or train cards and having them available at the organization so that you can provide transportation assistance to the staff, and that's one less thing that they have to worry about. Or maybe public transportation isn't safe, and so you're going to look into a way that you could maybe offer up shared ride services or a carpooling service amongst your staff. Medical care and coverage. Again, this might not be something that you are dealing with yourself or that your staff are personally impacted by because they're employed, so they have the healthcare benefits, but that doesn't mean that everybody in their family does. And so they might need assistance with enrolling in medical coverage and medical care. Or they might need assistance accessing medical care for family members, maybe urgent care, or understanding how to navigate telehealth for an aging family member. Also, our staff are being tested in our buildings, they're being vaccinated in our buildings, but their loved ones are not. And so making sure that you have information available on testing sites or where to access at-home test kits and where to access vaccination. There's a lot of different vaccine locators available, online systems. And so helping folks to figure out where vaccination sites are, and also having information available about how to get enrolled in those vaccination programs. And then parenting and caregiving, right? So maybe you are setting up some tutoring services so that parents can bring their kids in to get the assistance that they need. Or maybe you are making available some virtual learning resources. Maybe parents need some support around transitioning their children from virtual learning into a hybrid schedule or back to fully in-person courses. Our kids have continued to grow over the past year. So maybe setting up a clothing drive or a book donation or a toy donation, right? Our kids still need toys. They still need a childhood. And so being able to support staff in that way so that it's, one less thing they have to worry about, one less thing to spend money on, one less trip to the store, or one less online shopping at 10 o'clock at night. Again, making sure that you have information available about support groups. Maybe you want to look at medical equipment donations. Again, if they have an aging family member or a family member with some type of physical disability, do you have any medical equipment in your organization, or would you like to be a donation site? I know when I was working in the nursing home, we always had people who would call us up and say, "Hey, listen, I have a shower chair. I don't need it anymore. Can you accept it as a donation?" And so maybe putting together some donations so that your staff can then access those equipment for their families at home. And then also making sure that you have information available for your staff, for yourself, about how to access respite care or long-term care for their loved ones. It may be that they've had a aging parent who was living in their own home in the community, and the isolation over the past year or debilitation due to illness has made it so that that aging family member can no longer live on their own, and staff, despite working in long-term care, really don't know how to navigate the system. And so helping them to know who they can call up for respite care or who they can call up to start the admissions process. Another task, remembrance and mourning. And so, ways that we can support our staff through this task would be perhaps to hold a memorial service. We need to give space to really memorialize the people and the um, traditions that we have lost or missed out on over the past year. And this could be a socially distant memorial or this could be a virtual memorial, but it's still important to just have that space available. You also want to consider creating space for reflection. And so this could be mindfulness moments where you have a closed circuit television. Every morning there's a peaceful scene showing, and you have a suggested intention for the day, or it could be little intention cards, things to kind of remind staff to just take a moment, stop what they're doing, take a deep breath, and just tune into what their body is telling them, and what they're feeling and how they're experiencing themselves in the world right now. You could also be engaging in guided relaxation. Maybe every morning you go over the PA system and you take a few minutes to lead staff and residents through a guided relaxation. You could be encouraging journaling, artistic expression. There's a lot of healing benefit in being able to um, tap into your processing through artistic expression and through creativity. And maybe it's movement. And this could be some mindful movement like yoga or Tai Chi, but it could also just be movement, right? Like sweating it out, taking your mind off things by just working it out as hard as you can, or maybe as easily as you need to take it at that time, but getting your body moved and physically moving yourself from the space that you're in now to what comes next. And then also creating space for remembrance. And so this could take the place of like a memorial wall, or maybe you have certain rituals that staff need a space to perform or that you could perform as a group. Maybe it's totems. Maybe you paint some rocks and every staff member gets a rock and they can keep it in their pocket and grab onto it to just take a mindful moment and remember what they've been through over the past year and that you made it through it together. And I do want to make a note here. Your space for reflection should probably be different than your space for remembrance, right? Because your space for remembrance kind of immerses you in what you've been through. You are reflecting back on the past year, you are thinking about your losses and you're working through that. Your space for reflection is actually kind of taking yourself out, where you might need to step away from what you've been through and just focus on your breathing and focus on what your body feels like at this moment. And so, if you're trying to have that stepping out for reflection in the same space where you come for your remembrance, it might be a little bit too activating, and so staff may not be able to actually benefit from that reflection space if it's in the same space as a remembrance. And then lastly, you have reconnection and integration. And so there's a lot of different ways that this can take place. Maybe it's face-to-face virtual calls with friends or family. Maybe it's vaccinated visits, safe outdoor small gatherings according to CDC recommendations. Maybe it's virtual socials. And you could have these socials take place at different points throughout the day so that everybody can come in when they get off shift or when they have a break or something. Maybe you're going to do a happy hour. Maybe you're going to have a game night. Maybe you're going to have a watch party. I know some of the streaming services now have this little icon that you can click on for a watch party so that you're watching the movie in your house, but then your supervisor is watching the movie in their house, and you can watch it together and share this moment and be able to reflect on it together, even though you are socially distanced. Maybe you're going to encourage staff, or maybe you are going to give yourself the space to join a group, to develop a new hobby. You're going to join a book club. You're going to start language classes. Maybe you're going to pick up some exercise to really tune into those basic needs and to take care of your body. Maybe it is scripture study at your place of worship or whatever religious institution you hold sacred. There's also tuning into a bigger world. And I think that this is one that we don't really think of a lot, but there really is some therapeutic value in sitting down and watching a chick flick, right? Like, I remember a long time ago, I moved like more than 500 miles away from everybody and everything that I had ever known in my life. And it was really lonely. And I went to work and then I would come home and I would just be by myself all day, all night, and not really knowing the place around me. And somebody suggested, like, you're really isolated, why don't you get cable? And I had never thought about that before. But being able to subscribe to a cable service, I suddenly felt connected to the world again. And I think over this past year, we have been so isolated because of city lockdowns and because of state lockdowns. And we haven't been able to see our friends and family. And so something as simple as watching cable TV, not cable news, but being able to watch like reality TV shows or sitcoms or something can really help to connect us once again with the world around us, and maybe even help to connect us to the before times and what life was like before we completely had everything turned around. The same for like celebrity magazines. It can be really a nice step outside of our current realities to immerse ourselves in what the royal family is doing right now, or what so and so said on Instagram and how somebody else responded, just kind of taking that time out. And also volunteering. There are a lot of ways to volunteer right now. It may not be what you think of, like standing at a soup kitchen and serving, but organizations are still finding ways to offer volunteer options, whether it's helping to organize a virtual fundraising event, or maybe it is volunteering to do a check-in service and to call some of the elders in your community just to make sure that they don't need a light bulb change, or that they are able to get to their medical appointments. Things like that, where again, you're focusing on something that is bigger than you, that's outside of you and your daily life. And it really is giving back to other people, which is such a restorative and therapeutic thing. And of course, remember to be following CDC guidance as you move to resume or to modify your activities and your traditions going forward. Part of that reconnection and an integration of this is the way that I used to celebrate this holiday, and things are a little different now. But this is what we're going to do to try and hold on to the past while also moving forward into this new future. So I have included here some different resources that I found for Connecticut. Um, the CDC Stress and Coping is obviously a national resource, but it's a really good resource. They cover a lot of different topics here, and they have links off of this page. So there's links for grief and loss, substance use, reducing stigma. There's guidance for how to safely conduct funerals. Your Connecticut vaccine portal gives you information about eligibility, a vaccine locator, and how to schedule an appointment. Your testing locator, your mental health resources so that you can link up with resources for healthcare workers, resources for families. They have what they call warm lines, where it's like, I'm not necessarily in crisis, but I really need somebody to talk to right now, which I think is a brilliant idea. The 211 Connecticut for mental health support. And then this last resource I really liked, the Connecticut Relief and Support. This is where you're getting to some of those basic needs that go beyond your mental health needs. So your medical coverage, your mortgage and rent relief, your housing assistance, your transportation needs, and your unemployment benefits. So take a look through those resources, see what you can curate and what you can put together to be able to support your staff so that they can more effectively recover and be able to help residents and families through their recovery. Thank you all so much for your time. As I said, please don't hesitate to reach out to me at any time. And thank you so much for all of the work that you do. Thank you for who you are, and wishing you all the best of luck. Please take care of yourselves.